The administration, in its eagerness to pass a law that would let government rule over health insurance, wanted to make sure it had insurance companies on its side. How could it do that? Because Obamacare forces insurance companies to cover much more stuff. Insurers knew Democrats wouldn't allow them to sharply raise their rates to pay for that. So Obamacare's creators decided they'd tell insurance companies, if you lose money, don't worry, we'll bail you out. But they didn't want to call it a bailout. Bailouts to big companies, especially insurance companies, are unpopular. So instead, the administration used an obscure insurance company term, risk corridors. Risk corridors sounds meaningless. You can't get your brain around it unless you watch someone demonstrate it. But is it really this bad? Am I exaggerating? Let's ask the healthcare specialist Betsy McCoy. Is it really this bad?
It is. It is corrupt. You're fooling the public using the public's own money. You're saying to these insurance companies, price your plans lower than what you actually need to cover your costs, and we'll come around to the back door at the end of the year with John Q. Public's money to offset most of these losses. There it is in Section 1342. And then worse than that...
Betsy carries Obamacare with her wherever she goes.
And this is why it's so telling. This bailout expires right after the 2016 election.
They didn't want to make it permanent because permanent bailouts to companies would be really horrible, but it expires after he leaves office.
That's right. So the plans are supposed to look affordable until he's out of office. But everybody knows the insurance companies couldn't possibly price them that way. They have to cover, as you pointed out, so many extra things.
Alcohol rehab coverage, drug addiction coverage, care, obesity treatment, talk therapy, birth control, wellness visits.
Some people want this. Nobody wanted to pay for. It's like passing a law.
Well, some people wanted to pay for it.
Sure, but most didn't, or they would have been in the plans to begin with. It's like passing a law that the only car you're allowed to buy is a fully loaded Cadillac.
Obama sweetened the risk corridors after the law was passed.
Let's not use the word sweeten because there's nothing sweetened about violating the Constitution. What he did was to enhance these risk corridors and offer the insurance companies even more than the law allows, circumventing Congress and offering it all by himself because he had said, you can keep your plan a year longer. And the insurance company said, that's going to cost us a bundle. And then the president said, don't worry, we'll make it up to you quietly with John Q. Public's money again. But let me tell you something, John. We are entering the perfect storm for repeal, and this provision, Section 1342, ought to be the first thing repealed.
He told the insurance companies, the bill says the permissible profit margin is 3%, now it's 5%.
Yeah, that's a big increase. And plus insurance companies can incur expenses other than your health care, such as salaries and profit margins that they didn't have before. So it really did sweeten it for them, but it violated the Constitution because the president is not allowed to change the law by himself.